because I believe exercise is the investment. Eating clean is an investment for your future. Estrogen replacement is an investment for your future, where you're not going to fall and break the neck of your hip bone. I mean, it's all investment for the future. And I like to give this example. For example, before the age of 40, nature takes care of the women's body. But after 40, 45, we have to take care of our body, because estrogen declines, progesterone drops, testosterone drops, everything drops. And now we have to take the responsibility to replace it. But with the replacement, the lifestyle have to follow.
Yes. And I'll add, just as an aside, I see a lot of this online where a lot of these PhDs, I don't know if you're familiar with them, I'm not going to name names, but they don't see patients clinically, but they have strong opinions about women and menopause and maybe whether they need HRT or not. A lot of the messaging is sort of around this, you just need to build more muscle, you need to work harder, which I completely agree with. But I went into this, I'm hoping I'm at the end of perimenopause. I'm hoping I'm right at the cusp. I went into that in the best shape of my life with the most muscle mass. And it wasn't just little bitty weights. I was training for a kettlebell certification. I like Russian kettlebell, strong first, 16 kilo snatches.
Wow.
Like hardcore. I was in incredible shape and I had an incredible amount of muscle mass. And the lack of hormones, or the hormones leaving my body, still hit me like a freight train. Yeah. And for me, it manifested in just injury after injury. Just tissue tear after tissue tear that I couldn't quite get on top of. But I cannot imagine going into it in such abysmal conditioning that so many women are walking into it. They don't have any clue and they are abysmally conditioned. And that, anyway, talk to me about that, because you and I were saying, like, we both have chronic pain. If we don't exercise, we have worse chronic pain.
Right.
This is all part of it.
But again, we have also talked about peptides and menopause, but I want to stress the following. If you don't take care of your estrogen, progesterone, and your exercise, your muscle mass, peptides won't gonna do anything. Honestly, they are the messages. So what are the peptides? They are the messages that your body have to accept. But if your body is busy fighting with a lot of stuff, it's not gonna read the message. It's not gonna accept the message. So I believe that lifestyle should be number one, HRT number two, peptides, we need to talk about that after. But what women do nowadays, they all buy Rera online.
Yep.
Lose a lot of weight, a lot of muscle, a lot of fat, because nobody educate them that they have to eat, they have to exercise. They can't just take GLP-1 and sit on the couch and watch TV after work. They have to actually gain the muscle that to protect their bones. Because losing weight on GLP, if you're not doing it correctly, you can hurt yourself.
Talk about that, because I am very concerned with the fallout that we're going to see in the next 5 years.
Right.
From just mamsy-pamsy GLP-1 use without strength training. Because I have a lot of followers, and what I hear from them very often in mass, which breaks my heart, is, Dr. Tyna, I followed your advice and I went on the GLP-1 and it changed my life and I've lost 50 pounds and now I'm going to go to the gym and now I'm going to start strength training.
Oh my goodness.
That is my exact reaction. Let's talk about why.
Listen, every patient that comes to my clinic, and I actually make them guarantee to me that they will exercise, that they will eat their protein, and then I will give them GLPs. And if they say, yes, I do. Again, not everybody is compliant, but listen, I make sure I educate my patient. I give them examples. I show them pictures of anorexia. I show them picture of osteoporosis. I show them pictures of broken hips. And again, I believe exercise is the most important thing, because without the muscle, nothing will, listen, estrogen, progesterone, testosterone, peptides, if you have no muscle, nothing will protect you.
It has nowhere to land. Exactly. None of those things have anywhere to land and do their magic. I know, it's crazy. So on the flip side of that, something I see a lot around here, so I live in a pretty nice neighborhood and the local gym is fairly bougie. And I am seeing a plethora of middle-aged women that are my age and older, and they are skin and bones. They are all working literally their butts off. They have no butts. They have no glute muscles. And all they do is dink around with these little tiny dumbbells because they're all trying to get that sinewy, more emaciated look. Mm-hmm. Explain to the audience why that is a terrible idea, particularly at that age.
Well, you do need muscle to protect your bones from osteoporosis as well as protect when estrogen protects you because muscles feeds the bones. If there is no muscle, your bone are not being fed, and so you're going to break them. And again, exercise is an investment for your future. That's a quality of life that you want to have after 70.
Yes.
You know,
Yes.
that's the because you can be 70 and with broken hips, with I don't know, bedridden, I'm sorry, or you can be 70 and be still active, go on hikes, travel, and just live the life.
Yes, absolutely. I keep running into musicians that I followed that I was like madly in love, like Rick Springfield. You probably don't know who he is, but when we were little girls, Rick Springfield was like the dream boy, and he was on the soap opera General Hospital, and he was, a musician. And I think many of the girls in my generation, like that was our first tape that we ever bought was Rick Springfield. And a video was going around of him the other day. He's 76 years old. He's got no shirt on. He's singing from the stage. And yeah, he's had a lot of plastic surgery, but he looked fantastic. Like no shirt, looked so good. And I posted it on my stories, and the DM responses were off the chart. I mean, I got so many views and so many comments. The engagement was crazy. It was all these women that were like, oh my gosh, he's 76 and he's on the cusp of 77. So that's my mom's age, and it's vastly different.
Yeah.
Right. The outcomes. And I'm not trying to throw any shade at my mom, but like it makes a huge difference. And that's very difficult you don't get to that age, end up frail, and then build it. Yes, it's possible you can put some muscle on as you get older for sure, but it's so much harder when you're that far behind the ball, when you've really let it go. And
Right.
I think that starts in middle age at the latest. Like you really have to get your shit together in middle age at the latest.
And walking is not the thing.
Yes.
I want to stress that too. Because, I walk every day. Oh, really? That's just normal human thing. You got to walk. But this is not going to build your ass.
Yes.
It's not going to build the muscle around your thighs. It's not going to build anything. You have to do resistance training.